Welcome. My name is Suzanne Eckford. To briefly introduce myself, I am the head of the International Development and Training Team here at the VMD. I'm going to present an overview of the VMD's international activities, touching on our vision, purpose and strategic objectives, and following up with examples of the activities that we're undertaking to deliver these. Our overarching vision for our international work at the VMD is to strengthen regulation of veterinary medicines through collaboration with other national competent authorities and relevant international organisations and bodies, and through provision of accessible, tailored expertise and tools. Why are we doing this? At the broadest context, this is about the VMD as one of the leading regulators of veterinary medicines, contributing to the goal that animal keepers around the world have adequate access to safe, effective and assured quality medicines to enable them to appropriately treat and prevent disease in their animals. By doing so, we link into and support broader DEFRA and cross-government international priorities, as well as intergovernmental commitments such as the Sustainable Development Goals, to support higher animal welfare, the production of safe and nutritious food, and minimise risks to human health and to the environment. Here are a couple of examples to illustrate why veterinary medicines regulation is a core element of the wider One Health picture. This study took place in 5 countries in sub-Saharan Africa. The study interviewed farmers about their knowledge, attitudes and practices towards using antimicrobials. A common finding in the study was that observation of withdrawal periods, that's the time that farmers are required to wait after treating their animals before any products from those animals can be consumed, was limited. Farmers both consumed and sold meat, milk and eggs from animals undergoing treatment or still within the withdrawal period. This presents a potentially significant risk to consumer safety and therefore to public health. This second study took place in Uganda, and it compared the levels of medicines residues present in beef produced in rural versus urban locations. As you can see from the graph on the left, over 20% of the samples taken from adult beef contained residues of antimicrobials that were above an acceptable limit. The study authors noted that there has been a national policy on veterinary drugs in Uganda for nearly 2 decades. The policy specifically mentions the monitoring of drug residues in foods of animal origin, as well as the correct and safe use of veterinary drugs. Despite this policy being in place, its implementation has not been adequate, owing to lack of a legal framework and lack of infrastructure such as laboratories, as well as a lack of personnel to apply adequate enforcement. From our perspective, the VMD aims to support other national competent authorities to build their capacity in just such areas as these noted by the study authors. There are of course secondary benefits to our international activity. Collaboration with other countries provides the opportunity for knowledge exchange and access to additional expertise, and that helps to keep the VMD at the forefront of scientific developments. It also provides opportunities for VMD staff to evolve their skill sets. Development and training activities also provide additional revenue streams that give us more flexibility in how we cost recover and aid us to strengthen our workforce in order to safeguard our resource capacity and capability to deliver our core regulatory functions. We have 4 strategic objectives for our international activity. The first is to influence development of veterinary medicines regulation and policy through strengthening our global network. Now that we've left the European Union, we want to work with the wider global community to influence and shape the future global direction of veterinary medicines regulation and to improve standards for veterinary medicines and their use. We want to secure availability of medicines for our animal keepers by enhancing market opportunities for veterinary medicines manufacturers through our collaboration with other national regulators, by opening new routes for authorisations, whether that's mutual recognition or co-authorisation. We aim to make the UK a more attractive market for marketing authorisation holders. We also aim to help others to build their regulatory capability. This is not just altruistic. Effective regulation of medicines reduces the circulation of substandard or falsified medicines that might come to our shores. It also helps to ensure that medicines are used appropriately. So in the example that we saw earlier, respecting withdrawal periods, and that helps to ensure safer food. This focus on improvements in use of medicines links to our final objective 4, to contribute to improvement of global management of antimicrobial resistance in agriculture and aquaculture as part of a One Health approach. The use of veterinary medicines acts as a driver for antimicrobial resistance, and of course also for anthelmintic and ectoparasiticide resistance. In supporting others to address these risks, we also protect the UK. I just want to touch for a moment on why the VMD is well placed to implement our objectives. We have a reputation as a leading centre for regulation of veterinary medicinal products. A previous independent survey has placed us as the leading regulator within Europe, and we score highly on the benchmark of European medicines agencies. We're also ISO accredited. We've been accredited by the UN Organisation for Food and Agriculture as a reference centre for antimicrobial resistance, together with our partner agencies, CFAS and APHA. We're also committee members for the Pharmaceutical Inspection Cooperation Scheme, known as PICS, and we provide subject-specific expertise on aspects of veterinary medicines to the Codex Alimentarius committees, to the UN FAO, as well as to the World Organisation for Animal Health, known as OIE. And from next January 2021, we will have formal observer status at VICH, the international programme aimed at harmonising technical requirements for veterinary product registration. We also have an extensive mandate. We really do cover end-to-end veterinary medicines regulation, whether that's from governance legislation, strategy and policy frameworks, through to the actual authorisations process itself, to post-authorisation activities, including inspections, and of course the data management, infrastructure and processes that support efficient and effective activities. So how are we delivering these objectives? We have several strands of activities that interlock and complement each other. Over the following slides, I'm going to run through each strand of activity and give examples of the work underway across the VMD. The first strand is our efforts on developing collaborative authorisation. We have now signed Memoranda of Understanding with New Zealand, Canada and Australia. These MOUs allow for regular exchange of information on, for example, availability issues arising in each jurisdiction, and they also lay the groundwork for more extensive future collaboration to be developed. We have established an informal network with our equivalent agencies within Canada, New Zealand, Australia and the US that allows for discussion of emerging issues, for example such as the regulation of cannabinoid products. A process has also recently been established for managing simultaneous submission of applications with the Veterinary Drugs Directorate in Canada. More information on this can be found in the presentation given by my colleague Gavin Hall. Although currently there is no global forum for regulators to discuss emerging issues, the VMD supports the development of such an initiative, which could, for example, be stimulated through the VICH. The next stream of activities is what we class as sharing our resource, i.e. doing work on behalf of others. We have previously conducted pharmaceutical and biological dossier assessments, as well as GMP inspections for other countries. We have undertaken joint enforcement activities with the FDA, and we have informal arrangements in place with EU member states for concurrent GMP inspections. Undertaking this type of work provides options for counterpart agencies in other countries which perhaps do not have sufficient capacity or capability to undertake that work themselves, and it also provides an income stream. We will continue to offer this service in future. The third activity stream is that of building technical capacity, or enabling others to do their own work, which we approach in a number of different ways. We provide training for other national competent authorities. This can be delivered at the VMD or can take place within the recipient country. Training provided ranges from high-level introductory sessions through to specialist technical training that takes place over a number of months, and training is tailored according to recipient needs. Some training is delivered by the VMD alone, and some in combination with our AMR Reference Centre partner agencies. As part of developing our training offer, particularly under the current restrictions on travel, we are exploring options for delivering distance learning packages to increase our training accessibility. We are also conscious of the importance that national stakeholders can access the training they need, and so we have recently launched an online questionnaire to gather feedback on any perceived training gaps. We had an excellent response to that questionnaire, and we're currently in the process of analysing the results. However, if you did not get a chance to participate, then we would still welcome any feedback you wish to provide. Please just contact us on the VMG General Inquiries email. In addition to direct training, we provide expertise to various initiatives. For example, recently we've provided technical experts for the UN FAO Working Group on development of a pre-qualification scheme for foot and mouth vaccines. We've also undertaken more comprehensive integrated capacity development programmes. One example would be our work with the Ethiopian National Competent Authority to undertake detailed gap analysis of their processes and infrastructure, supporting them to develop a pathway to address those gaps and improve their regulatory capability. A second example is our review of national regulatory frameworks within sub-Saharan African countries and the development of a roadmap towards harmonisation of veterinary medicines regulation within the region. Both of these projects are described in more detail in the presentation given by my colleague, Noel Joseph. Capacity building activities are funded either directly by recipients or via securing external aid funding. One of our challenges is to secure sufficient funding to meet the demand that we have encountered from a number of lower and middle income countries that recognise the importance of VMP regulation in enabling development of their livestock sectors and thereby improving agri-based livelihoods and reducing poverty. In addition to providing technical expertise and training, we also have the wherewithal to create the tools that facilitate or underpin improvements in regulatory capability. Provision of these tools is demand-led. Examples that the VMD has recently or is currently engaged in developing include submissions portals, benchmarking tools and databases. As mentioned in the previous slide, we are also in the process of developing a learning management platform and distance learning content, which will complement our existing training activities. Our next activity stream focuses on addressing the many evidence gaps that exist in relation to what, how and why veterinary medicines are manufactured, distributed, supplied and of course, and importantly, used, particularly but not limited to, in countries with immature regulatory systems. Filling these evidence gaps is an essential step in persuading decision makers that change is necessary and to encourage them to invest in strengthening their regulatory capacity. Where possible, we seek to support generation of this evidence. We do so both by acting as a source of expertise and as a partner for bodies engaged in evidence generation, including academia, but also by seeking the funds to support activities that lead to improved data sets. Finally, achievement of our objectives would not be possible without extensive national and international engagement. This underpins all of the activities described in previous slides. Influencing, working through and with others is key to our strategic goals and brings many benefits as we charter our post-EU course. In regard to our international counterpart agencies, we recognise that there is wide variation in regulatory capacity across countries, both within and between different geographical regions. Although our partnerships with other countries will each be unique, we anticipate that the nature of our engagement and collaboration with any specific country will fall into one of three broad categories. It may focus on regulatory development, so for example capacity building, training and helping to build collaborative support networks, or moving on to regulatory consolidation, where the focus may change to provision of services and tool development, through to collaboration with other regulatory leaders, with a focus on scientific exchange and development of collaborative authorisation processes. Whatever the nature of our collaborations, our aim will remain to support the strengthening of veterinary medicines regulation for the benefit of animal health, public health and the environment. We have now come to the end of this webinar. Thank you for listening. If you would like more information on any of our international activities, please follow the directions on the following slide.
The VMD welcomes any questions that you might have. To ask your questions, please go to www.slido.com and use the event code 96607. Slido will be open for your questions until Friday the 20th of November. Responses will be published to your questions by Friday the 27th of November. If this presentation hasn't met your accessibility needs, please email director.support@vmd.gov.uk. Thank you.